Hey guys, today we'll be talking about the oculomotor nerve and the functional components. Okay, this is MBBS Niger. Do subscribe to our YouTube channel, follow us on TikTok, like our Facebook page at the MBBS Niger. Okay, so now what are the questions? The question is you see a patient who has diplopia. Now, while testing her eye movement, you notice that the patient cannot easily elevate her right eye. You also observe that the patient's right pupil is dilated and non-reactive to light. Okay, so now CT scan of the head shows aneurysm of an artery. So now aneurysm of an artery is like the artery swelling up. Okay, so name the nerve that is injured, state the functional components of the nerve fibers involved. Now, which artery is most likely to have aneuritic to cause this lesion? Okay, and provide neuroanatomical explanations from the clinical features of this patient. Okay, so definitely we know the nerve lesion is the right oculomotor nerve. Now, why is it the right? Okay, you could see that here they stated it in the right eye. So you must be specific. You can't just say oculomotor nerve. You have to be specific. You have to say the right oculomotor nerve. So what are the functional components of the oculomotor nerve? Is a somatic efferent, all right, or the somatic visceral efferent. Okay, so the artery most likely to have been aneuritic to cause this lesion is the right posterior cerebellar. Okay, sorry, the right posterior cerebral artery. Okay, so this is just an animation in the oculomotor nerve and how it goes to supply the muscles of the eye. Okay, supply all the muscles of the eye except superior oblique and the lateral rectus. Okay, so now having stated all those conditions, we go ahead to state the neuroanatomical reasons. So the patient cannot easily elevate the right eye. This is because you talk about the muscle that is responsible for elevating the eye, and the muscle responsible for elevating the eye is what? Inferior oblique muscle. So if the patient cannot elevate his eye, that means the inferior oblique muscle is paralyzed. Okay, so the patient cannot easily elevate the right eye. This is because of the paralysis of the right inferior oblique muscle, which causes elevation. Okay, now there is an unopposed action of the superior oblique muscle which acts to push the eye downward, whose innervation is intact. That's the trochlear nerve. Okay, and this follows that the patient right eye is dilated and non-reactive to light, and this is because of the paralysis of the constrictor pupillae and the unopposed actions of the dilator pupillae. Of course, the dilator pupillae is responsible for dilating the eye, and the constrictor pupillae is constricting the eye. So if the dilator pupillae is working unopposed, it's just dilate the eye and leave it like that. Okay, so this is a dilated eye. Where's a dilated eye? This is a dilated eye, also known as what myodrasis. My recorder is blocking it, but a dilated pupil is also known as what myodrasis. Okay, and the pupil is non-reactive to light. This is because of lesion of the oculomotor nerve. Diplopia, this is because of the patient's inability to steady the eye for vision. Okay, guys, with this this is the lesion of the oculomotor nerve. The oculomotor nerve is a functional component. Okay, sorry, aneurysm of the posterior cerebral artery. All right, so that's how I'll name this video. Okay, building from that fact. Okay, so see you guys in the next and bye for now.